Hello viewers, welcome back to my channel. This is Dr. Anil Kumar T, Uro-Oncologist and Robotic Surgeon. Last time we had discussed about prostate cancer. This time we will discuss about bladder cancer. You know what is urinary bladder? It's a muscular sac which is present in the lower abdomen deep within the pelvis, which collects urine from both the kidneys, and whenever it becomes full, it pumps out and pushes the urine out of the bladder. Bladder cancer is the sixth most common cancer. It most commonly affects males, but females are also not spared. So, what are the causes for this bladder cancer? Age, exposure to industrial chemicals like benzenes and also aromatic hydrocarbons, recurrent and chronic UTI, smoking, and also other hereditary factors. So, what are this staging of bladder cancer? It can be broadly staged into non-muscle invasive bladder cancer and muscle invasive bladder cancer. What is non-muscle invasive bladder cancer? When the bladder cancer is limited to only one or two layers of the superficial epithelium of the bladder, it is called non-muscle invasive bladder cancer. When it has spread deep into the muscles of the urinary bladder, it's called muscle invasive bladder cancer. How does these patients present to us? They usually come to us with blood in urine. It can be either visible to the naked eye or it can be examined under a microscope. Other symptoms like increased frequency of urination, going to bathroom every time at night, that is increased frequency at night also, difficulty in micturition, burning during urination, and also loss of weight and also loss of appetite can also be symptoms of this bladder cancer. How do we diagnose this? See, diagnoses have different modality. One, it can be diagnosed with urine cytology. Other than that, ultrasound abdomen and pelvis. After that, cystoscopy is needed in suspicious lesion, where we put a camera inside the urinary bladder, and when there is a suspicious lesion, we take out the biopsy. After the cancer is diagnosed, in order to stage this disease, we need certain imaging studies like MRI abdomen and pelvis, CT scan abdomen and pelvis, and also FDG PET CT scan. Once this is diagnosed, we need to treat it, right? How do we treat it? One is transurethral resection of bladder tumor. It is also called TURBT, where we put the cystoscope into the bladder and take out all the tumor from the bladder. The other surgery is radical cystectomy, where whole bladder is removed along with the lymph nodes. So when you remove the bladder, or the patient can void, we usually create two things when bladder is removed. One is called ileal conduit, where a piece of foot pipe is taken and joined to the ureters, which is the urine pipe, and the other end of this foot pipe comes out through the abdominal wall. The other thing is we can place a new bladder made out of the intestine, foot pipe, within the abdomen itself. This is called neobladder. So this radical cystectomy is done when there is a muscle invasive bladder cancer. Other than this, when the patient wishes to spare his bladder, we can treat him with chemotherapy and also radiation therapy. Nowadays, a new treatment is coming up in such a way that it can treat all the cancers. This is called immunotherapy. In bladder cancers, this immunotherapy has a great role. In around 25% of the patients, the disease is not visible at all nowadays. After learning this treatment for bladder cancer, we should also learn how do we prevent it. One is to maintain a regular good lifestyle, that is to quit smoking and to have regular healthy diet, which includes having good amount of vegetables and fruits, and also minimizing this exposure to industrial chemicals, and also preventing and also treating promptly this recurrent UTI. Today we discussed about bladder cancers. In our further videos, we'll be discussing about all the tumors of this urinary tract. Thanks for watching my channel. Kindly subscribe to it. Have a good day.